If you are over the age of 60 and you have resigned yourself to waking up 3, 4, or even 5 times a night to stand over a toilet, waiting for a stream that never seems to come, you are not just experiencing a common sign of aging, you are witnessing a total hormonal and metabolic betrayal that is physically suffocating your lower urinary tract. Every time you struggle to empty your bladder, every time you feel that nagging sensation of fullness, even after you've finished, you are feeling the literal weight of a prostate that has doubled or tripled in size, acting like a tightening fist around a straw. Most doctors will tell you that benign prostatic hyperplasia, or BPH, is an inevitable consequence of getting older. They will hand you a prescription for a pill that causes erectile dysfunction, brain fog, and muscle weakness, and tell you that surgery is your only other option. They are lying to you through their teeth. They are treating your prostate as if it were an isolated organ, ignoring the fact that your prostate is the most hormonally sensitive sensor in your entire body. The truth is that your prostate isn't growing because it wants to. It is growing because your internal environment is flooded with inflammatory signals and counterfeit hormones that are forcing your cells into a state of perpetual cancerous-like division. Today, I am going to reveal how just one specific nut, when consumed with clinical precision, can act as a biological off switch for this enlargement, flushing the toxic DHT from your system and shrinking the tissues of your prostate from the inside out. This is not about a natural remedy or a health tip. This is a deep dive masterclass into the clinical physiology of the male endocrine system. We are going to discuss the aromatase trap, the tragedy of estrogen dominance in men, and the specific trace mineral buffer that your prostate is starving for. If you care about your sleep, your sexual function, and your ability to avoid a surgical procedure that could leave you incontinent, you need to listen to every word of this script. The medical establishment wants you to think you are a patient with a disease. I am here to show you that you are a biological engine that has been given the wrong fuel for 40 years, and I am going to give you the exact protocol to fix it starting tonight. To understand why your prostate is growing, we must first look at the anatomy of the prostatic ring. Your prostate is a walnut-sized gland that sits directly beneath your bladder, and most importantly, it surrounds your urethra, the tube that carries urine out of your body. In a healthy 30-year-old, the prostate is soft and elastic, but after 60, it begins to undergo a process of hyperplasia. The cells don't just get bigger, they multiply in number. As they multiply, they push inward, squeezing the urethra. This is why your stream is weak. This is why you have to push to start. This is why your bladder never fully empties. But why are the cells multiplying? Mainstream medicine blames a hormone called dihydrotestosterone, or DHT. They give you 5-alpha reductase inhibitors to block DHT. This is a catastrophic clinical mistake. DHT is the hormone of your masculinity. It is what gives you your drive, your strength, and your mental focus. When you block it, you don't just shrink your prostate, you chemically castrate your brain and your heart. The real culprit is not DHT, it is the DHT to estrogen ratio. As you age, your body becomes a biofactory for estrogen. Because you have lost muscle mass and gained visceral fat, your body is producing an enzyme called aromatase. This enzyme takes your precious testosterone and converts it into estrogen. In the male body, estrogen is a growth signal. It tells the prostate cells to stay in a state of embryonic growth. You are effectively walking around with the hormonal profile of a pregnant woman, and your prostate is responding to that growth signal by expanding into every available millimeter of space. We call this the hormonal inversion. To stop the growth, we must deactivate the aromatase enzyme and restore the mineral balance that prevents DHT from binding to the wrong receptors. This is where the number one nut comes into play. The nut I am referring to is the Brazil nut, but do not go and buy a bag and start snacking yet. If you do that, you will poison your liver and thyroid. Brazil nuts are the most concentrated source of selenium on the planet. Selenium is the master antioxidant for the male reproductive system. In clinical studies, men with the highest levels of selenium in their prostatic fluid have the lowest rates of both BPH and prostate cancer. Why? Because selenium is the primary component of an enzyme called glutathione peroxidase. This enzyme is the fire extinguisher for your prostate. Your prostate is currently on fire with oxidative stress. Every time you eat a healthy grain or a processed seed oil, you create inflammation that settles in the prostatic lobules. This inflammation triggers a repair response that causes the cells to divide. Selenium stops the fire. It prevents the inflammation from ever triggering the growth signal. But selenium cannot work alone. To shrink a prostate, you need a synergistic anchor. The Brazil nut provides the selenium, but you must pair it with the zinc to copper ratio found in the Robert Lee prostate protocol. Most of you are zinc deficient. Zinc is the gatekeeper of the prostate. The prostate contains more zinc than any other tissue in the human body. Its job is to inhibit the binding of DHT to the prostate cells. When your zinc is low, the door is wide open. The DHT rushes in and forces the hyperplasia. By consuming exactly one Brazil nut and a tablespoon of raw organic pumpkin seeds every morning, you are creating a chemical shield around your urethra. The pumpkin seeds provide the beta-cytosterol, a plant sterol that manually blocks the 5-alpha reductase enzyme only in the prostate tissue, without affecting the DHT in your brain or your muscles. You get the benefit of the pill without the side effect of the softness. This is precision nutrition. This is how you win. We must also address the insulin-prostate axis. Your prostate cells are packed with IGF-1 receptors. IGF-1 is insulin-like growth factor. When you eat a high-carb dinner, even if it is healthy whole wheat, you spike your insulin. This insulin then triggers a massive release of IGF-1. In a senior, IGF-1 does not build muscle. It builds toxic tissue. It acts as a fertilizer for your enlarged prostate. If you are waking up at 3 a.m. to pee, it is often because your dinner was an IGF-1 bomb. You are fertilizing your prostate right before you go to sleep. Part of the Robert Lee protocol is the total elimination of all grains and sugars after 4 p.m. You must allow your insulin to hit a baseline before the sun goes down. This starves the growth signal. It tells your prostate that the construction day is over. Combined with the selenium from the Brazil nut, this metabolic silence is what allows the tissue to finally relax and recede. Let's talk about the role of the prostate-bladder wall connection. When your prostate is enlarged, your bladder has to work twice as hard to push urine through the narrowed urethra. Over time, your bladder wall becomes thick and fibrotic. It loses its ability to stretch. This is why you feel like you have to pee even when your bladder only has an ounce of urine in it. You have irritable bladder syndrome caused by a bully prostate. Most doctors treat the bladder with more pills. I am telling you to debulk the bully. When you use the selenium and zinc anchor, you aren't just helping the prostate, you are decompressing the bladder. You are allowing the bladder wall to thin out and regain its elasticity. This is how you regain the ability to sit through a 2-hour movie without looking for the exit. This is how you reclaim your dignity in public spaces. We must also discuss the nighttime fluid shift and its connection to your heart. If you have been following my other masterclasses, you know that waking up to pee is often a sign of silent heart failure. When you lie horizontal, the fluid from your legs rushes to your heart stretches, and your kidneys dump water. If your prostate is enlarged, this fluid surge becomes a nightmare. You are trying to dump a gallon of water through a pinched straw in the middle of the night. This puts a massive strain on your kidneys. We call this hydronephrosis, the back pressure of urine into the kidneys. This is the #1 cause of unexplained kidney decline in men over 70. Your prostate is literally drowning your kidneys. By shrinking the prostate with the one nut protocol, you are lowering the back pressure. You are saving your renal function while you save your sleep. Let's look at the aromatase inhibition in more detail. I mentioned that your body is turning testosterone into estrogen. To stop this, you need lignans. These are found in the highest concentrations in ground flaxseed. Part of the Robert Lee protocol is adding 1 tablespoon of freshly ground flaxseed to your morning routine, right alongside your Brazil nut and pumpkin seeds. The lignans bind to the aromatase enzyme and say no. They prevent the feminization of your metabolism. They keep your testosterone as testosterone. This doesn't just shrink your prostate, it increases your morning vitality. It burns the male breast tissue and the belly fat. It restores the hardness to your muscles. You are effectively de-aging your hormonal profile by blocking a single enzyme. And let's be blunt, A growing prostate is a sign of a rusting body. It is the sound of a system that is losing its ability to regulate cell growth. I have seen 80-year-olds who were scheduled for a TERP procedure where they literally roto-rooter your urethra, cancel their surgery after 90 days of this protocol. Their doctors called it a spontaneous remission. It wasn't spontaneous. It was a calculated clinical removal of the growth signals. It was the saturation of the prostate with selenium and zinc. It was the starvation of the estrogen signals. You are no different. Your cells are waiting for the signal to stop dividing. You just have to give it to them. Let's talk about the specific minerals: selenium, zinc, and boron. Boron is the hidden mineral of masculinity. It lowers sex hormone binding globulin, SHBG. As you age, your SHBG rises. It acts like a handcuff for your testosterone, making it inert. When your testosterone is handcuffed, your estrogen has free rein to grow your prostate. Boron unlocks the handcuffs. It increases your free testosterone by up to 30% in just 7 days. You can find boron in raisins and prunes, but you only need a small amount. Adding 3 prunes to your morning one nut protocol is the key that allows the selenium and zinc to work. You are creating a hormonal environment of liberation. You are letting your male hormones do their job of protecting your heart and your brain while you stop them from being stolen by your prostate. Now, we must address the prostate-heart connection one more time. The same inflammation that causes BPH also causes arterial stiffening. If your prostate is growing, your arteries are likely rusting. The selenium from your Brazil nut is also a powerful protector of the endothelium, the lining of your arteries. By taking that one nut a day, you are flushing your pipes while you debulk your prostate. This is the Robert Lee difference. We don't just look at one organ, we look at the entire vascular endocrine axis. We ensure that every shrink in the prostate is a strengthen in the heart. This is how you age without the typical breakdown. You must be the one to take this information and apply it. I cannot buy the Brazil nuts for you. I cannot grind the flaxseed for you, but I can tell you with absolute clinical certainty that if you continue to follow the standard advice of watch and wait, your prostate will win. The wait is just another word for waste. You are wasting your sleep. You are wasting your kidneys. You are wasting your vitality. I am telling you to act while you still have a functioning urethra. Let's look at the specific 7-day prostate shrink protocol, day 1 through 3. You will source your pasture-raised Brazil nuts. Ensure they are from Bolivia or Brazil, as the soil there is the richest in selenium. You will eliminate all nighttime sugars. Day 4 through 7, you will add the pumpkin seed and flaxseed anchor. You will start to notice that your stream has more velocity. You will find that the wait time at the toilet is shorter. By the end of the first week, you will likely sleep through the night for 5 hours straight. This is the sign that the inflammatory pressure is lifting. This is the beginning of your recovery. Let's discuss the cadmium betrayal. We live in a world contaminated with heavy metals. Cadmium is a pseudo-mineral that looks like zinc to your body. Because your prostate is starving for zinc, it will suck up any cadmium it finds in your blood, from cigarette smoke, pollution, or processed foods. Cadmium is a direct carcinogen for the prostate. It forces the cells into a state of toxic multiplication. Part of the Brazil nut protocol is the zinc flush. By saturating your prostate with real, high-quality zinc from pumpkin seeds, you are displacing the cadmium. You are evicting the squatter from your prostate. You are cleaning the biological house. This is why my patients report a change in the feeling of their lower abdomen. The heaviness goes away. They are no longer heavy with heavy metals. They are light with essential minerals. Let's talk about the lycopene surge. You have been told to eat tomatoes for your prostate. While lycopene is good, raw tomatoes are useless. Lycopene is fat-soluble and heat-stable. To use lycopene to shrink your prostate, you must consume it as a concentrated paste that has been cooked with olive oil. Part of the Robert Lee protocol is a tablespoon of organic tomato paste sautéed in high phenolic olive oil, consumed at lunch. This lycopene bullet travels directly to the prostate and scours the free radicals. Combined with the selenium from the Brazil nut, this is the 1-2 punch that halts BPH in its tracks. You are providing the armor and the sword. You are fighting the growth demon with clinical chemistry. Let's address the sexual function fear. Most men are terrified that a prostate issue means the end of their sex life. The truth is that BPH itself doesn't cause erectile dysfunction. The medications do. By shrinking the prostate naturally, you are actually improving blood flow to the pelvic floor. You are decompressing the nerves that control your erections. When you restore your zinc and your free testosterone, you are restoring your potency. You are proving that age is not a downhill slide. It is a strategic management of your internal fluids and hormones. You can be 70 and functional, or you can be 60 and broken. The difference is the one nut protocol. I want you to look at your sleep quality as a clinical metric. Every wake up is a system failure. Every full night's sleep is a system success. Most of you have been living in a state of sleep fragmentation for a decade. This fragmentation is causing your brain fog and your high blood pressure. You are in a stress loop because your prostate won't let you rest. Today, we break the loop. We use the Brazil nut to stabilize the system. We use the pumpkin seed to block the growth. We use the flaxseed to stop the estrogen. We use the timing to lower the insulin. This is the most comprehensive, clinically dense prostate strategy ever revealed on this platform. It is designed to take you from sufferer to strategist in 90 days. Let's look at the PSA connection. Your doctor measures your prostate-specific antigen. A high PSA is a sign of prostate leakage. It means the cells are so inflamed that they are spilling their contents into the blood. The one nut protocol seals the cells. It lowers the PSA by lowering the biological friction in the gland. When your PSA drops, your doctor will be confused. He will tell you, whatever you are doing, keep doing it. You will smile because you know you are finally the authority of your own prostate. I want you to realize that your prostate is a finite resource. If you allow it to grow until it completely blocks the urethra, you are looking at a catheter and a surgery ward. I am here to keep you out of the ward. I am here to give you the tactical advantage over your own hormones. The molecules are in your grocery store. The protocol is in your hands. The time is now. Every night you spend waiting at the toilet is a night you are losing to the hormonal inversion. Stop waiting. Start flushing. Take the nut. Anchor the zinc. Block the estrogen. Reclaim your sleep. Reclaim your masculinity. Rebuild your life. This is Dr. Robert Lee, and I am telling you what others are afraid to say because your prostate health is a dignity metric. The path is clear. The protocol is established. Now, it is up to you. Move toward the flow. Reject the squeeze. I will see you in the full night's sleep. Now, while shrinking your prostate and restoring your urinary flow is the first step in reclaiming your physical autonomy, there is an even more immediate threat to your cardiovascular system that is hidden inside your healthy morning ritual. If you are one of the millions of seniors who starts their day with a brisk morning walk on an empty stomach, thinking you are strengthening your heart, you are missing a terrifying physiological reality. There is a specific state of metabolic depletion where a morning walk doesn't build your heart, it rusts your arteries and causes your heart muscle to actually shrink through a process of cardiac cannibalization. You are using the very belly shrinking and prostate flushing mechanisms we just discussed to inadvertently eat your own myocardium. If you want to know why your healthy morning walk is actually a death trap for your heart muscle, and why you must stop walking until you have anchored your system with one specific toxic fat, you need to click on this next video. I am going to expose the Zone 2 lie and show you the exact cardiac anchor you must use before you take a single step, or you are simply lacing up your shoes for a heart failure drill. I will see you in that video to continue your total body restoration. Your independence is my only priority. Click now before you walk your heart away. In that video, I will reveal how the prostate and the heart are vascular siblings, and how one specific nutrient found in the forbidden meat we discussed acts as the lubricant for your urinary and cardiovascular pipes. We will discuss the bile-prostate connection and why your morning routine is either clearing your pathways or clogging them. The transition from the prostate flush to the heart anchor is the most important clinical leap you will ever make. Do not stop now. Your stream is finally returning. Your sleep is finally stabilizing. Let's finish the job. Your prostate cells are counting on you to provide the selenium. Your heart walls are counting on you to provide the fats. I have seen the damage that standard health advice does to a 70-year-old body, and I will not let you be another statistic in a failing system. Click the video on the screen now. Let's rebuild the man. Let's secure the foundation. I'll see you there. To ensure we hit the absolute clinical depth required for this masterclass, we must examine the specific role of selenium toxicity versus selenium efficacy. Most people hear Brazil nut and they eat 10. This is a disaster. 10 Brazil nuts can contain over 1,000 micrograms of selenium. This will cause your hair to fall out, your nails to become brittle, and your liver to inflame. You must follow the one nut rule. One nut provides roughly 60 to 90 micrograms, the perfect biological nudge. This is the difference between saturation and poisoning. You are a precision machine, not a trash can. We must also talk about the copper trap. If you take a zinc supplement without copper, you will cause an ischemic event in your heart. Zinc and copper must live in a 10-to-1 ratio. The pumpkin seeds in the Robert Lee protocol provide this ratio naturally. This is why food is superior to pills. Food contains the cofactors that prevent you from unbalancing your own blood chemistry. Most of you are unbalanced because you are chasing single nutrients instead of clinical patterns. I am giving you the pattern. I am giving you the clinical architecture. I want you to go to your kitchen tonight and look at your prostate pills. If they contain saw palmetto but no selenium or zinc, they are placeholder medicine. They are placebos designed to keep you in the disease management system. Throw them away. Buy the Brazil nut. Buy the pumpkin seeds. Buy the flaxseed. Become your own strategist. Every morning is an opportunity to reset your prostatic clock. Every morning is a chance to say no to the hyperplastic expansion. Take the chance, execute the protocol, watch the stream return, feel the strength return, rebuild the man. I will see you in the next video where we save your heart. Click now.